Medicare is confusing. The plans and rules are complicated, and there are so many different options for coverage. In the months before you turn 65, you get bombarded by every insurance company, each one claiming that they have the right Medicare coverage for you. This video will help you sort through all the confusion and sales pitches to find out what type of Medicare coverage is going to work better for you. This is also helpful if you've been on Medicare for a while and it's time to review your choices to make sure that you're still in the right plan for you and not paying more than you need to. Most people have two major options for Medicare coverage. Original Medicare Parts A and B, plus a Medicare Supplement, which is also known as a Medigap plan, and a standalone Medicare Part D prescription drug plan, and possibly coverage for dental, vision, and hearing care. Or a Medicare Advantage plan that combines the benefits of Medicare Parts A and B and includes Medicare Part D drug coverage. You might wonder, why don't people just take Medicare Parts A and B and nothing else? Medicare Parts A and B have no out-of-pocket spending limits. For example, with Medicare Part B, once you've paid the annual deductible, which this year is $240, you are responsible for 20% of the cost of all covered outpatient medical services, with no limit. It doesn't matter if that 20% adds up to tens or hundreds of thousands of dollars. If you have no coverage beyond Medicare Parts A and B, you are responsible to pay all of it. Because of the lack of financial protection under Original Medicare Parts A and B, virtually all Medicare beneficiaries will also enroll in some other type of Medicare coverage. It's important to note up front that there is no one-size-fits-all, absolute best Medicare plan that's the same for everyone. Each person has unique medical and financial situations. The right coverage option for you might not be the right option for your family members or your friends. That's okay. We have lots of choices in Medicare coverage, so we can find the one that's going to work the right way for you, not just enroll in the same plan that your friends or your family members have, because even if it works for them, it might not work well for you. It's also important to mention that no Medicare plans are free. You will pay for healthcare in different ways depending on your plan choice, but none of these options are free. First, no matter what Medicare coverage you choose, you will have to enroll in Original Medicare Parts A and B. Medicare Part A has no premium cost for most people. This is the part of Medicare that's been prepaid by your FICA taxes all the years you've been working. Medicare Part B does have a monthly premium cost. In 2024, most people pay $174.70 per month for Medicare Part B. However, this is income dependent. High income individuals will pay more, and folks with low income may pay less. Include your Medicare Part B premium cost in any estimate of healthcare expenses. Let's talk about the big difference in how you pay for your healthcare if you have a Medicare Supplement plus standalone Part D plan versus having a Medicare Advantage plan. If you choose a Medicare Supplement and standalone Part D plan, you will have monthly premiums that you need to pay to be enrolled in both of those insurance plans. For a more comprehensive Medicare Supplement, those premiums can be anywhere from around $100 up to over $300 per month. The prices vary quite a bit depending on where you live, your age, and other factors. You can expect your Medicare Supplement price to increase once per year. You pay these premium costs and have rate increases whether you use your insurance or not. The trade-off for paying those higher premium costs every month is that when you go to the doctor's office or the hospital, you will have very low to no extra out-of-pocket costs for your medical care. For example, if you choose a Medicare Supplement Plan G, your medical costs covered by Medicare Parts A and B are capped at no more than $240 for 2024, which is the Medicare Part B outpatient annual deductible. Medicare Advantage plans are the opposite. Medicare Advantage plans may charge a monthly premium to be enrolled in the plan, but many don't. They are able to keep their monthly fees generally lower than Medicare supplements or even at $0 because Medicare pays a contracted amount to the insurance company every month to manage the care for each person who is enrolled in that Medicare Advantage plan. Medicare makes those payments since the insurance company is now taking on the risk of paying for the health care of every person who enrolled in their Medicare Advantage plan. If you have a Medicare Advantage plan, you keep paying your Medicare Part B premium to Medicare. Then Medicare will send over that amount plus more to the insurance company every month in order to manage all of your healthcare needs. With a Medicare Advantage plan, if you need to see a doctor, go to the hospital, have any kind of medical treatment, that is when you are charged. There are set plan deductibles, copays, and coinsurance amounts that you pay as you receive medical care throughout the year. Every Medicare Advantage plan has a maximum out-of-pocket spending limit in order to protect enrollees' finances. If you hit that limit with your spending on covered medical expenses, then the insurance company will pay 100% of your covered medical costs through the rest of the year. In 2024, the maximum allowed out-of-pocket spending risk for a Medicare Advantage plan is $8,850. In most of the country, there are Medicare Advantage plans with far lower out-of-pocket risks. That's the big difference in how you pay for your health care with these two options. With a Medicare Supplement and standalone Part D plan, you have more predictable monthly costs and lower out-of-pocket risks if you need medical care. With Medicare Advantage, you may have lower or no monthly costs and generally higher out-of-pocket risks if you do need medical treatment. Medicare Advantage plans are set up similarly to the type of health insurance that you are already familiar with, whether that is an employer group health plan or an individual plan through the Affordable Care Act. It's one insurance policy for all of your health care with a managed care design that anyone who has been in an HMO or a PPO is already familiar with. Going with original Medicare Parts A and B, plus a Medicare Supplement, a standalone Part D plan, and a dental vision hearing plan is a different design than something like your employer healthcare because all of those policies are individual, not combined. You will have different ID cards and insurance policies for different parts of your healthcare. You'll have your Medicare card, Medicare Supplement card, Medicare Part D prescription drug card, and dental vision and hearing card. With Medicare, drug costs are handled separately from health costs. When it comes to drug coverage, you will pay a copay or coinsurance with either coverage option, whether a standalone Medicare Part D policy or Part D coverage included in Medicare Advantage plans when you pick up your medications. And you may have to reach a deductible before being eligible for lower copays for your medications. Let's look at the coverage differences. Will I have original Medicare coverage? Original Medicare is Medicare Parts A and B. Medicare Part A is inpatient insurance. Medicare Part B is outpatient insurance. Whether you choose a Medicare Supplement or a Medicare Advantage plan, you have full original Medicare Parts A and B coverage by law. If you have a Medicare Supplement, original Medicare Parts A and B is your primary health insurance, and the Medicare Supplement pays what would otherwise be your responsibility if you only had original Medicare Parts A and B, things like deductibles, copays, and coinsurances. Medicare Advantage plans are required to cover at least as much as original Medicare Parts A and B, and that standard is checked every year before these plans are allowed to be marketed to the public. Virtually all Medicare Advantage plans have coverage that goes beyond what is covered under original Medicare Parts A and B. If you choose a Medicare Advantage plan, that plan becomes your primary health insurance rather than original Medicare. Are there medical provider networks? With a standard Medicare Supplement, there are no provider networks. You can see any doctor and go to any hospital that accepts Medicare and is accepting Medicare patients. The exception to that is Medicare Select Medicare Supplements, which do have networks. For more information on those, please see the video linked above. Medicare Advantage plans have provider networks. Some Medicare Advantage plans will only cover your care if you see an in-network provider. Those are HMOs, health maintenance organizations. Other plans will cover treatment from out-of-network providers, usually at a higher cost to you. Those are PPOs, or preferred provider organizations. It is very important to make sure that all of your doctors and hospitals are in a Medicare Advantage plans network before you enroll so that you don't get unexpected medical bills later. All Medicare Advantage plans have worldwide emergency coverage. If you are traveling outside your plan's area and have a medical emergency, your plan is required to cover your care at in-network rates. Now, this does have to be a true medical emergency, and there may be limits to the dollar amount that plans will cover in this situation. So read your evidence of coverage and summary of benefits before you enroll. Will I need referrals or have to go through prior authorization? With Original Medicare and a Medicare Supplement, it is very rare that a person would need to go through prior authorization. However, it does happen for procedures that can be medically necessary but are also offered as elective procedures. For the vast majority of medically necessary medical treatments, Original Medicare has no prior authorization and no referrals are needed. Medicare Advantage plans may require referrals in order to see specialists. That's far more common in HMOs than in PPOs. Many medical procedures require prior authorization if you have a Medicare Advantage plan. Although horror stories get a lot of publicity, it's really pretty unusual to have a prior authorization request denied. And more than 80% of the time, if the doctor appeals a prior authorization denial, that decision gets reversed. We help all of our Medicare Advantage clients if they run into any kind of an issue with prior authorization. And almost all of the time, the situation can be resolved quickly and in favor of the client. Is coverage the same from one plan to another? Medicare Supplement coverage is standardized by law. This chart shows the standard Medicare Supplement coverage offered in 47 states. Wisconsin, Minnesota, and Massachusetts have different plan designs. If you want, for example, a Plan G, every company in your state that offers Plan G has to have exactly the same benefits as shown here. However, monthly premium costs are very different from one company to another, so it's important to comparison shop. Medicare Advantage coverage is not standardized, so it is important to look at each plan individually to make sure it's a good fit for you before you enroll. Are there plans that offer extra coverage? Original Medicare does not cover routine dental, vision, or hearing care. Medicare supplements are only allowed to fill the gaps in Original Medicare. So Medicare supplements do not offer extra coverage like dental, vision, hearing, transportation, and other benefits. Some Medicare supplements do come with discount programs for those extras, which might be enough for you. If you need more coverage than what is provided by the discount programs, you can look at separate insurance policies for things like dental, vision, and hearing care. Many Medicare Advantage plans offer extra benefits. These are not the same across all Medicare Advantage plans. So if these are important to you, make sure you compare the benefit offerings from all the different companies before enrolling. One thing to be aware of. Often the very rich benefits that you see mentioned in commercials are not available to most Medicare beneficiaries. Those are usually limited to plans for people who qualify for both Medicare and Medicaid. What happens when you receive medical treatment? With a Medicare supplement, your provider submits a claim for medical services to Medicare itself. Medicare determines if the claim is covered, and if it is, Medicare will pay its part and send it on to the Medicare Supplement company, which will pay its part. Medicare supplement companies can't argue with claim decisions made by Medicare. This means you will never have to fight with your Medicare supplement company about a claim. All of those decisions are made by Medicare. That also means if Medicare denies a claim that was submitted by your doctor, your Medicare supplement company cannot pay anything toward your costs for that claim. Medicare Advantage claims are determined by the Medicare Advantage insurance company. All of these plans have to include coverage that is at least as good as Original Medicare, but the costs to you are not identical to what they would be with Original Medicare. It's important to look at each plan's deductibles, co-pays, and co-insurance, and maximum out-of-pocket costs for medical services, and know what the process is for disputing a claim decision before you enroll. When you're looking at a Medicare Advantage plan's summary of benefits, Pay close attention to the medical deductible and the maximum out-of-pocket risk. Many of us coming from high deductible health plans at work are used to seeing a pretty high number for that medical deductible. That is generally not the case with Medicare Advantage plans. In fact, many Medicare Advantage plans have $0 deductibles. That means you don't have to pay a large amount out of pocket before the insurance kicks in. If your plan has a $0 deductible, that means your out-of-pocket costs will be the copays and coinsurance amounts as shown in the summary benefits and evidence of coverage documents. Those copays and coinsurance amounts are tracked through the year, and if you meet the plan's maximum out-of-pocket risk, you are done paying for covered medical care for the rest of the year. With most Medicare Advantage plans, it is difficult to reach that maximum out-of-pocket limit. Only 3 to 5% of Medicare Advantage enrollees meet their out-of-pocket maximum spending limit in a calendar year. Even though the risk is small, it's good to do the math before you enroll so you can see what the worst case scenario could be. Estimated costs. Let's go through some estimates so you can see approximately what either option would cost you on a monthly basis and in a calendar year. Now, what you have available in your zip code might be different. I am using 2024 averages for this comparison. Most people pay $0 for Medicare Part A, $174.70 per month for Medicare Part B. In this example, we are going to use Medicare Supplement Plan G, which has a nationwide average cost of around $150. Medicare Part D has a nationwide average premium cost of $55.50, and dental and vision insurance for an average cost of $40 per month. Again, these are nationwide averages. Your actual costs may be higher or lower. If we add all of these, we have a total premium cost of $420.20 per month. Your out-of-pocket risk is the Medicare Part B annual deductible of $240 plus drug copays and dental and vision copays. Your total for the year would be $5,282.40 plus those drug copays and dental and vision copays or coinsurance amounts. If you have a great year, you don't go to the doctor for anything except preventive care, you have no medications, and you only have preventive dental care and routine vision care, your cost will be $5,042.40. Just the premium costs to be in those insurance plans. If you have a terrible year, lots of office visits, inpatient hospital stays, extra medications, and on, your cost will be $5,282.40 plus drug copays that for most people end up totaling around $3,300 before they reach catastrophic coverage, and dental and vision copays and coinsurance. In this worst case scenario, we're looking at a total cost of $8,582.40 plus dental and vision charges. On the other side, we have $0 for Medicare Part A, $174.70 a month for Part B. We'll take the average Medicare Advantage plan premium, which this year is $18.50. There are Medicare Advantage plans that have $0 per month plan premiums, and then at the other end of the spectrum, there are some that are over $200 per month. This premium number is going to heavily depend on where you live, which plan has your doctors in network, and which has a design that is going to work well for you. Per month in this estimate, you will be paying $193.20 in premiums. That annual premium cost would be $2,318.40. To find your out-of-pocket risk, you have to add the premium cost to the out-of-pocket maximums for both the health side and the drug side of the Medicare Advantage plan. Just like in the standalone Part D plan example, people pay out around $3,300 before reaching the catastrophic drug coverage level. On the health side, the government has limited Medicare Advantage plans out-of-pocket risk to individuals at $8,850 in 2024. There are many plans with far lower maximum out-of-pocket risks. The nationwide average, which we'll use here, is about $5,500. If you have a good year with few to no office visits and medications, your cost will be $2,318.40. The worst case scenario would be that premium cost plus the $3,300 drug cost to get to the catastrophic level, plus the average health maximum out-of-pocket risk, which is $5,500. That gives us a total of $11,118.40. As mentioned earlier, it is tough to reach your Medicare Advantage plan's out-of-pocket maximum. Only 3 to 5% of enrollees ever do. However, it's always best going in to know what the worst case scenario would look like. Can I change coverage later? Medicare Advantage plans change every year. Everyone has an opportunity to change their plans during the annual enrollment period between October 15th and December 7th. This is the time of year when you have the most options open to you. People who have a Medicare Advantage plan can also switch to a different Medicare Advantage plan during the Medicare Advantage open enrollment period, January 1st through March 31st. You may also have special enrollment periods open to you during the rest of the year, depending on where you live. You will also have the opportunity to change coverage if you move out of your plan's service area. Keep in mind that if you change Medicare Advantage plans mid-year, the deductible and out-of-pocket maximum tracking all starts over. In most states, once you are beyond your first 6 months on Medicare Part B, you will have to answer health questions and be approved to qualify to purchase a new Medicare Supplement. Depending on your health and the laws in your state, it may be easier or far more difficult to impossible to change your Medicare Supplement in the future. Which type of coverage works better? It's really up to each individual. There is one limitation that should be noted. If you are on both Medicare and Medicaid, you cannot purchase a Medicare Supplement without giving up your Medicaid benefits. People who are dual eligible for both Medicare and Medicaid can enroll in Medicare Advantage plans, whether one that is designed for folks who are dual eligibles or one that is just designed for people who have Medicare. If you have a serious chronic health condition that requires a lot of treatment, a Medicare Supplement is likely going to work better for you in the long run than a Medicare Advantage plan. For everyone else, the choice is yours. If you prefer fairly predictable monthly costs and low out-of-pocket risks when you receive medical treatment, take a look at Medicare Supplements. If you would rather have low monthly costs and pay for medical services as you receive them, take a look at Medicare Advantage plans. Once you've narrowed your choice to one type of coverage or the other, there are still plenty of options open to you for either Medicare Supplements or Medicare Advantage plans. This is when you get down to comparing specific plans from specific companies. For that, you will need tools like Medicare.gov, insurance company websites, your state Department of Insurance website, Medicare publications, and insurance company documents. Now you can do all the comparison shopping between available plans and companies on your own, but it's time-consuming, complicated, and can get frustrating. Plus, there's absolutely no benefit to doing it on your own. Medicare plan costs are the same whether you put in all that time and effort on your own and enroll direct with the insurance company, or you enroll through a Medicare plan broker who does all the research and comparison shopping for you. This is what we do for our clients. We work with many different insurance companies and can comparison shop with you to find the plan and the company that's going to work best for your situation. We do this completely free of charge for our clients. We are able to do that because for every enrollment into a Medicare plan through our office, we are paid a commission by an insurance company. The commissions are very similar across different plans and different insurance companies, so we have no reason to push you toward one option over another. We are free to find the plan and the company that fits each individual client's needs the best. Once you are a client of ours, you have free ongoing access to help. Whenever you have a question about your coverage, or when premiums go up, or the Medicare annual enrollment period rolls around again, and it's time to reevaluate and possibly change plans. If you have Medicare questions, please feel free to give the office a call at 877-312-1414 or reserve your free, no obligation Medicare plan consultation using the link in the description. We're here to help you understand your options and find the right Medicare coverage for you. Have a great day.